interested in how to pass clinicals, what is clinicals, and how to get through it, this video is for you. What it is, what's up? What it is, what's up? What it is, what's up? Hey y'all, and welcome back to my channel. If you're new here, hi, my name is Tatiana and I'm a BSN nursing student. If you're a returning subscriber, hey y'all, hey. So I am back with another video, and if you're interested in how to pass clinicals, what is clinicals, and how to get through it, this video is for you. So without further ado, let's get into the video. So if you clicked on this video, you're wondering, what is nursing school clinicals? I always hear people all the time talking about what is clinicals, what is clinicals, what is clinicals. If you're just now getting into nursing school, sometimes you'll be like, what is this? What is clinicals? So I'm going to explain, what clinicals are. What is the purple? What's the purpose of clinicals, and tips and tricks and all of that good stuff. So let's start off with what is a clinical rotation, because that's what it's called. When you're in nursing school, you're gonna have clinical rotations based off whatever class that you're in. For example, if you're doing health assessment, you're going to have a clinical tied into health assessment. For example, the purpose of clinical rotation is to help expose you to what you're learning. So instead of just trying to learn how to assess a patient, like getting subjective and objective data, subjective data being stuff that the patient is telling you, like, oh, I've been having a sore throat for the last 3 days, or I've been having a fever, or I've been feeling fatigued, or I've been feeling lightheaded. Those types of things are subjective data. Objective data is things that can be measured, meaning like vital signs. Think pain. What's your pain on a 1 to 10? That is objective data. Data that can be measured. Your labs, things like that. That's your objective data. That's why those two are important. And when you're in clinicals, you're going to be applying the use of subjective and objective data. You're going to be using your subjective data, what the patient is telling you, and you are be tying it into your objective data of what you're actually seeing. If someone is in pain, their vital signs may display that they're in pain. But like I said, the purpose of the clinical rotation is to help expose you, because not everybody works in the actual healthcare field or has ever worked in healthcare. For some nursing students, this is your first time even being in healthcare. So clinical is to help you get that experience, that hands-on experience, to help further add to what you're doing. So like, it's not just like you're reading a textbook all day long about, let me read in this book about how I need to take care of a patient, but you ain't never physically taking care of a patient. How does that work? How does that help you? So that is the point. That is the purpose of your clinical rotation. And the best way that you can make your clinical rotation the best is to every opportunity, for every opportunity, do it. If you have an opportunity to start an IV, do that. If you have an opportunity to pass meds, do it. But make sure your clinical instructor there, liability. But never say no. It will be a tip when it comes to, unless it's like something that's like you're just really uncomfortable with. But the whole process of clinicals is to help you learn. If you're sitting at clinicals and you're not doing nothing, you can't expect to get experience if you're not hopping on opportunities. If you see a patient about to get ready to go down to surgery or something, hey, let me let me go down there and see that. Like, you take those opportunities to be able to add to your experience of what you're doing. If you have a chance to with everybody that's doing clinicals, you're going to have to do a head to toe assessment, meaning you're going to have to assess the patient from the top of their head to the bottom of their feet. You're going to have to do that every single time you go to clinicals. You're going to have to incorporate a head to toe assessment, because you get report, but you have to be able to see for yourself what is going on with the patient, because sometimes what you may see on the chart may not align with what's really going on with the patient. So your head to toe assessment is always so important, because if you miss something and something happens, they're gonna look at you like, didn't you say that you do the head to toe assessment, but this is going on and you didn't know? That's the whole purpose of everything. Clinicals is that time for you to try to get as much as you can out of your experience. Don't worry about if, you know, some of the nurses not as welcoming or not as open armed. You're there to try to get your experience, as much experience as you can, because I'm not gonna say every clinical day you're gonna have all of these things you can do. It might be sometimes that the clinicals, all you're doing is ADLs or giving patients baths, or, you know, doing like wound care, or just doing the basic like nursing process things for the patient, getting the patient ice, getting the patient water, you know, those types of things. When you're in clinicals, the best way to make the best of it is to be willing to learn. You're never going to know too much. It's going to always be an opportunity for you to learn something. So keeping an open mind on what is there for me to learn today, or what do I want to go in here to learn today. With health assessment, like, that's your first part, because you have to know how to start basic care for the patient, and that's, you know, doing your assessment of the patient. And then that's when you're gradually, when you start your med search class, you're going to have your med search clinical. So you're going to be working on the floor with patients that is a little bit more critical. But at the end of the day, your nursing process based, meaning like there's nothing that's above you. And I'm just being honest, because sometimes people think they're too good to clean a patient or bathe a patient, or, you know, wipe a patient's butt. None of that. You're not above any of that, because that's all within basic care of taking care of a patient. So don't ever get in the mindset of saying that's a CNA job, or that's, you know, because at the end of the day, you're the nurse. You're supposed to be the person that's taking care of this patient. So don't get in that closed box mindset of thinking that something is above, you know, what you can't do. I hate to hear people, and I'm a CNA, being like, oh, I don't do that, that's a CNA job. Well, ma'am, you know how to do the same thing that I'm doing. So, you know, grinds my gears. But the like I said, the purpose of the clinical is to give you that opportunity to be able to learn, to be able to apply what you're learning in class, and be able to see it in real life and in person, because not everybody has that opportunity to do that. That's the whole point of the clinical rotation. Tips, some more tips that I would recommend is always be, if you don't, when it comes to like medications, always look at your patient's medication, your patient's MAR, the medication sheet. And if it's medications that you're not familiar with, look it up. Look it up. Because you don't want to be, you know, with that patient all day, and you know that they have this issue, but you're in there and they're getting meds passed to them, and you don't know what type of medicine they even taking or why they're taking it. You need to make sure that you understand not only what you're doing, but why are you doing it. Why is this patient getting Lovenox and he's here? Oh, for blood clotting. Those types of things. So why is this patient getting this diuretic? you want to make sure that you know the basis of what's going on and not being in the I don't know, because that I don't know can be like a life or death type of thing. So you want to make sure that you're getting familiar with the chart, getting familiar how to document. I'll put my timestamp of how I do my clinical paperwork up here, but it's a lot. But once you get the hang of it, it's gonna be like second nature. You're gonna be going through there like, oh, okay. I'm not saying that you're gonna be just top nurse of the year just based off your clinicals, because like I said, every clinical day is not gonna be a jam-packed day. But at the end of the day, you want to make sure that you're doing the best that you can and you're utilizing all the opportunities that you can to help you learn and help you grow. So like I said, clinicals can be really hectic. Clinicals can be tough sometimes, and you can have good days, you can have bad days, but always remembering to take a time, and first of all, take a time to just be like, okay, what's going on? What can I do? And yeah, you want to always be, you want to be, make sure you are useful and not useless. You get what I'm saying? So yeah, that's my biggest, tidbit for clinicals, is making sure that you're utilizing all of your opportunities to learn things. Like I said, some things you might not get a chance to do until you graduate, but just make sure you take all the opportunities that you can to do what you need to do. Because like for instance, for my OB clinical rotation, I was able to put in a Foley catheter. Because with OB, you with certain specialties, you're gonna have more opportunities to do like a specific skill than another. So it just depends on what type of patients you have, what's going on, and yeah, that's just the basis of like clinicals itself. But like I said, if you don't know something, look it up, ask your instructor. Just be willing to learn. Be willing to learn, and nothing is above what you can do. And leave your feelings at the door, because at the end of the day, like, these people are sick, these people are in the hospital, they don't need your drama along with what they already going through. So my biggest thing, like, customer I know it'd be like customer service is everywhere, but you want to make sure your patient is getting the best patient care experience that they possibly can. Like, sometimes they may not start off all happy-go-lucky. They may not be as nice to you, but that doesn't mean you have to be mean to them. It might be something that's going on that it has nothing to do with you, but it's just like they're not happy right now. Who would be happy if they got all this stuff going on with them? Not saying it's okay for them to talk to you the way, or talk to you reckless or anything like that, but you want to make sure that you are staying neutral when it comes to that, because at the end of the day, you're the nurse, you're the person that's supposed to be helping them. You're not helping them if they at a 10 and you at a 22 and they like, yeah, blah 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 blah. Well, you shouldn't have been talking to me. You can't do that. You can't do that. You can't treat pop and mama like that. You can't do that. So you gotta like, sometimes I be having to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. What you just say to me? In my mind, but I'm in present moment, in helpful Tatiana mode. I'm like, okay, well, if there's anything I can do or help with, you just let me know. They might get an attitude with you. They might, they'll get over it, because guess what? I'm gonna come back in there. Hey, are you okay? I just need to come in here and check you for this. They gonna get tired of seeing me. It's okay. And they eventually get on to the fact that, oh, she's not faking this. She's actually here to actually help me. Like, even though I just be like, I don't appreciate how you talking to me, but I'm still here to help. So yeah, but my clinical experiences have been good. Sometimes they have been overwhelming, especially with working and then turning around and then having a quiz or exam and then school and then repeat. So I'll make a separate video on how I balance all of that. But I just wanted to just hop on here and just tell y'all like about how clinicals can be for you. Clinicals is what you make it, honestly. It's just what you make it. I feel like anybody that is going to be doing clinicals, they're gonna have days where they like it, they're gonna have days where they don't like it. Clinicals is really where you start to see what type of specialty you want to get into. So that's why I feel like clinicals is important, because that's going to really steer you into like, oh, I want to go in peds, or I want to be in OB, oh, I want to be in med surge. Like those are, I want to go to the ICU. You know, those experiences is what you go through in nursing school itself. So I hope this video helps. Don't forget to like and subscribe to my channel if you haven't already, and stay tuned for the next video. And don't forget that I will be doing a giveaway once we reach 500 subscribers. And I thank you guys so much for watching my video, and stay tuned for the next one.